talking about the anatomy of the intervertebral disc. Intervertebral discs are located between the vertebral bodies of C2, C3 to L5, S1, totaling 23 in the conventional spine. Together, they account for approximately 25% of the total height of the
شو
vertebral.
الصوت ماكو بس يمي لو يمكم همينه
محمد صوتك ناصع عليه.
Okay, stop. Intervertebral discs are located between the vertebral bodies of C2-3 to L5-S1, totaling 23 in conventional spine. أستاذ هسه الصوت واضح؟
أنا ما واضح.
واضح أستاذ؟
نعم.
Together they account for approximately 25% of the total height of the vertebral column. This decreases with age as the disc height is lost. The discs are wedge-shaped in the cervical and lumbar region and consequently contribute to lordosis in these regions. In the thoracic region, they are flat. The disc to body height ratio is 2 to 5 in the cervical spine, 1 to 5 in the thoracic spine, and 1 to 3 in the lumbar spine. The major component of the intervertebral disc are the nucleus pulposus, the annulus fibrosus, and the cartilaginous endplates. The nucleus pulposus is located centrally in the disc. It's a gel-like substance composed of fibrocartilage that is predominantly type 2 collagen and proteoglycans. About 90% of its content is water, rendering it hyperintense on T2 weighted images, and of intermediate signal intensity on T1 weighted images. It becomes more fibrous with age. The annulus fibrosus surrounds the nucleus pulposus. It is composed of dense fibrous tissue. Due to its fibrous nature, it appears black on all MR pulse sequences, particularly T2 weighted images. It is attached circumferentially to the vertebral body via the Sharpey's fibers, which continue into the longitudinal ligaments and vertebral bodies. The anterior annulus is thicker than the posterior annulus, resulting in the nucleus pulposus lying relatively posteriorly within the disc. It is firmly attached to the anterior longitudinal ligament, but loosely attached to the posterior longitudinal ligament. It's a usual site of rupture in the degenerate disc. The cartilaginous endplate has two parts: a peripheral part, which is a fibrocartilaginous and covers the apophyseal ring, and a central part, which is a hyaline cartilage and covers the vertebral endplate. The vertebral endplates are numerous pores through which the vascular channels extend. Diffusion of gadolinium into the disc has been shown through these channels. The intervertebral disc is avascular by the age of 25 to 30 years. The disc receives nutrition by diffusion through the endplates. The nucleus pulposus has no nerve supply, while the outer annulus is supplied by the sinovertebral recurrent meningeal nerves. Intranuclear cleft. In adult, it is a septum-like structure can be seen to transect the middle of the nucleus pulposus in the horizontal plane. It represents a fibrous transformation of the gelatinous matrix of the nucleus pulposus. These discs show a linear T2 hypointense signal through the center of the nucleus pulposus from anterior to posterior, which is a normal variation. Intranuclear cleft. Radiology of the intervertebral disc. On the plane radiograph, the disc space rather than the disc itself is visible. The disc space at L5S1 level is narrow, and this should not be taken as a sign of a disease. This shows the Ferguson view of lumbosacral junction, an AP view with 25 cranial angulation demonstrating L5S1 disc space tangentially on the L5 pars and face. On the plain X-ray films of the spine, degenerative disc disease is characterized by narrowing of the intervertebral space, endplate erosions with reactive osteosclerosis, formation of the osteophytes, intradiscal calcifications, and intradiscal gas. Vacuum sign is a radiolucent defect in the annular and nuclear degenerative fissures due to the presence of nitrogen gas. It's indicative of advanced disc degeneration. Discography. Discography is performed by the injection of the contrast medium through the annulus fibrosus into the nucleus pulposus of the intervertebral disc. It's usually performed in the lumbar region to establish whether a disc above a proposed fusion is normal. In a normal disc, contrast medium remains within the confines of the annulus fibrosus. In this case, contrast material that had been injected into the nucleus pulposus has extravasated through a tear in the annulus fibrosus in this CT scan. Computed tomography. The intervertebral discs are seen as low attenuation structures between the vertebral bodies. It's difficult to distinguish between the nucleus pulposus and the annulus fibrosus. The importance by the recent development of multi-detector raw CT. This axial CT scan shows the annulus fibrosus and the nucleus pulposus. In this sagittal CT view of lumbar region, beside the disc protrusion in the lower lumbar segment, calcification of L2, L3 intervertebral disc was noted. MRI. MRI is the most accurate and sensitive modality for the diagnosis of septal pathology. It allows direct visualization of herniated disc material and its relationship to the neural tissue, including intrathecal contents. The normal adult disc represents an intermediate to low signal intensity on T1 weighted images and a high signal intensity on T2 weighted images when compared to the bone marrow in the adjacent vertebral bodies. On T2 weighted MRI scans, the normal bright nucleus pulposus and the inner annulus are indistinguishable. Normal adult endplates and ligamentous structures, as well as the outer annulus fibrosus, has low signal intensities on both T1 and T2 weighted images. The outer annulus, which contains densely packed fibers, is hypointense on all pulse sequences and is optimally demonstrated on T2 weighted images. In middle-aged and elderly subjects, the bright signal intensity of the intervertebral disc on T2 weighted images gradually decreases until the disc becomes hypointense. T2 weighted scans are best suited for detecting degenerative disc. Though the decrease in the T2 signal intensity is an age-related physiological phenomenon, it predisposes the disc to degenerative changes, such as the loss of the disc height annular tears, and disc herniation. This sequential axial images through L5 to S1 on the right side at the level of the inferior end plate, and on the left side at the level of L5 S1 disc. Number 1 is showing the L5 vertebral body. Number 5 showing the thecal sac. Number 7 showing L5 S1 intervertebral disc. And number 9 showing spinous process of L5. A disc bulge represents the displacement of the outer fibers of the annulus fibrosus, involving more than 1/4, 25%, or 90-degree angulation of the disc circumference. Disc bulge involving more than 25% of the disc circumference. It is either circumferential or asymmetric. On the left side, T2 weighted axial MRI of the normal L3 disc. Its posterior part is concave. On the right side, T2 weighted axial MRI of L3 in another patient. Posterior disc has lost its concavity and bulged out in a smooth fashion. Disc herniation refers to the displacement of the intervertebral disc material beyond the normal confines of the disc, but involving less than 20% of the circumference. It is divided into protrusion and extrusion. Disc protrusion involving less than 20% of the disc circumference, the base is wider than the herniation. Disc extrusion, also less than 25% of the disc circumference, but the difference from protrusion is the base is narrower than the herniation. Disc sequestration is a subtype of extrusion. There is a free fragment of disc material with no connection to the disc. In this image, there is a large sequestration fragment extending from L3, reaching the disc of L4. Start وصلنا للكويز تايم.
اوكي محمد.
كمل.
يلا تفضل.
Number 1.
دكتورة سعدت.
نعم أستاذ. Number 1, intranuclear cleft between of the intervertebral disc between L1 and L2.
Number 2.
فرح زهير رقم 2.
نعم عمو الانترفيرتبرال intranuclear cleft.
رقم 1 انترنيوكلير كليفت.
لا رقم 2 هذا شنو؟ فرح.
نعم أستاذ.
رقم 2 موجودة انتيريال وبوستيريال يخف بالنيوكليوس بالبوسس.
راحت الصورة عمو من يمي.
اوكي ايمان حميد.
نعم أستاذ. annulus fibrosus.
annulus رقم 3 ورا ايمان سماء عطية.
دكتور nucleus pulposus.
نيوكليا اللي هي برايت. ورا سماء هاني.
رجعت الصورة.
يلا هسه مو مشكلة. رقم 4 شوفي لنا اياها. شو تمثل لنا فرح هاي؟
هذا عمو anterior longitudinal ligament.
اكسلنت. مرتضى رقم 5.
نعم أستاذ. posterior longitudinal ligament.
اوكي عشت يدكم. استاذ محمد.
عين أستاذ راعي. رقم 1 ياسمين.
nucleus pulposus.
nucleus pulposus رقم 1. ورود رقم 2.
annulus fibrosus.
annulus fibrosus. هديل كريم رقم 3.
رقم 3 عمو intravertebral column.
رقم 4 مصطفى خضير.
أستاذ هاي fecal sac.
نعم كل زين. عاش اليوم.
عاشت ايدك يا محمد، كلش انطاح.